Actually, it was my husband who started with when Dr. Smith was over in Fishers, and that was probably 10, 15 years ago, and I just started going, to Dr. Smith's office, and I've been with them ever since. The staff is great. Usually greeted by Jada or June, and then usually one of the technicians come in, one of the dental assistants come in, and they go in and take you back. And they're always very nice. They greet me by name all the time. I know who they are, they know who I am. So it's really a great office for a dentist's office, it really is. My very back tooth was cracked, and it cracked, Dr. Smith said it cracked oddly. He said it cracked in the wrong direction. So he said since it's the back tooth, they cannot bridge it. There's nothing to connect there. So he suggested an implant. What he did was they first pulled the tooth. They went through the whole scenario on what was going to go through each scenario. First of the pulling of the tooth, then building up the bone underneath, so when they put the implant in, it's going to be really solid. And they had a specialist that actually came in and made sure that the size of the tooth, the person that made the tooth, it was going to fit in there correctly. It was the right size for my mouth. And I mean, it took probably about 6 months. I started in September, and it was done by April or May, because the most important thing is to make sure that there's enough bone there for them, so it's going to be a solid tooth and nothing's going to be wrong. I don't even know it isn't my tooth. I mean, they made it so this is like the tooth belongs to me. Dr. Smith, shaved it down and, designed it where it is fitting my mouth. I wouldn't know that it wasn't my tooth. I would rather now have the implant rather than a root canal. I know it takes longer, but I know I'm never going to have to do that again. That tooth is there forever. It'll outlive me. Dr. Smith's very gentle. He's very conscious. He watches actually while you're sitting there, and if you make any kind of move that he assumes isn't normal, then he's like, "Are you okay?" I'm like, I'm fine. I was just readjusting here. So, he's very conscious of, if you're in any kind of pain, he'll stop right away, and then he'll try something else. So I've never had any problem. And I have a high pain tolerance, so he's pretty good anyway. I think in the olden days, you just went to the dentist and they just almost grabbed pliers and yanked type. A lot of people still have that conception of that's what a dentist office is. I don't think a lot of people realize how much in advance. To give you an example, when they did the headshot, it was Dr. Smith that found out that I have sleep apnea, and he actually went in and got me in contact with a sleep doctor, and now I wear a CPAP. Even if Dr. Smith has to go someplace, I've had him call me at night, and he's in a hotel somewhere, and he goes, "Oh, I'm over at so-and-so, wherever." And he goes, "Just checking on you, how are you doing?" That's very personable. It's like he cares about, how are your feelings? Is there anything wrong? Is everything going okay? Are you in pain? That type of thing. So I think it's very personable. I've been coming here 10 to 15 years. Keep coming back because he does have the newest, latest, greatest technology, and I wouldn't have known about my sleep apnea if it hadn't been for him, because it might have been 10 years more down the road, which could result in more, it's rough on your body. So I just like him. I just like their office.